Hello friends, Namaste. This is the first week of our course, certificate course in integrative palliative care. And so far, you already know about what is palliative care. That particular lecture was taken by Dr. Geeta Joshi. And thereafter, she discussed the main issue also, that is the integrative palliative care. What is integrative palliative care? And this is the third lecture in the same series, and my lecture is today is complementary medicine. Integrative medicine was taken by Dr. Geeta Joshi, and I am taking complementary medicine. And if you combine both, then it becomes CHEM. We call it complementary and alternative medicine. But today I am going to talk only about complementary medicine, because that's the main thing what we are going to discuss in this particular course of 3 months. The lecture has been prepared by Dr. Geeta Joshi, but I am just taking it. Complementary medicine is a term used to describe types of treatments you may receive along with conventional Western medicines. Now, you already know alternate medicine and complementary medicine. In alternate medicines, you means you have left the old course of medicine and you have started a new course, like you had been taking allopathy, but you want to change over to homeopathy. So, there homeopathy becomes alternate medicine. You are not going on the old route of allopathy. But when I say complementary medicine, means you are going on both the routes. You are taking allopathic medicines also, at the same time you want to try naturopathy and all other medicines which are part of complementary medicines. And therefore, I written, understand this, because this is what we are going to talk about in next 3 months, alternate medicines and complementary medicines. Complementary medicine is a term used to describe types of treatments you may receive along with conventional Western medicines, that is the allopathy medicine. That means you are not living, you are going to continue that particular course which has been prescribed by your doctors. Understand it nicely. When you take complementary medicines, does not mean that you stop the medicine what you had been taking earlier. Examples of complementary medicine include massage therapy, meditation, biofeedback, that is what we call energy healing techniques like Reiki or EFT, emotional freedom technique, etc. Tai Chi, Reiki. Tai Chi and Reiki, basically they are the part of TCM. What is TCM? Traditional Chinese medicine. Traditional Chinese medicine, that's TCM. And in TCM we have got so many things like Tai Chi is there, Reiki is there is Qigong, meditation and motions, movement, they go together. Music therapy, guided imagery and dietary supplements, etc. These all these therapies, they are the part of complementary therapies. When you take these therapies along with your old system, maybe anything like allopathy or homeopathy, there are no side effects at all. Understand this. Okay. Here we come. Differences between all these sort of terms, so that there is no confusion in your mind. You are totally 100% clear what we are talking about. Complementary medicine or therapy are additional methods, in addition to what you had been taking, that are used along with modern medical approaches like medications, immunotherapy, chemotherapy, radiation and surgery in case of cancer patients. It complements, it adds to it, adds to the effect. It complements what you had been taking it. It complements these traditional medical approaches. Come to alternative medicines. It's an approach used in place of modern medical approaches. You stop going to your own allopathic doctor, you just stop taking those medicines and you change over to new method, that is a complementary methods, that is alternative. You stop the previous method totally and you change over to new route, that is alternative. Now comes integrative. The word gives you the meaning integrative. Integrative means to combine. To combine. Consider your entire health and wellness, not limiting the therapeutic approach to the specific disease or organs involved. It focuses on the mental, emotional, functional, spiritual, social and community aspects of your health. Total well-being. In other words, we can call it holistic. All the aspects which are very, very important to become a good human being, to enjoy the life what God has given to us. It consists of physical fitness, it consists of mental fitness, emotional, spiritual, belief in God and belief in humanity, social, you interact with your friends, neighbors, relations, peers, seniors, everybody, and community. Here we are talking about community is very important to us. In our first lecture about what is palliative care, Dr. Geeta Joshi must have told you what is the importance of community approach in palliative care. I will also when I come to my 6th or 7th lecture, there I am going to talk about community based palliative approach. So, all these aspects when they combine holistic approach, it becomes integrative medicine. Remember this now, do not get confused at all. We have got complementary. Complementary means 1 plus 1, addition. Alternative means you go, I take something new. Integrative means I take everything inside, physical, mental, social, emotional, community, everything, holistic. Some more terms, we call it traditional. Traditional medicines has a long history. Traditional, what's a tradition means? It is just coming generations earlier it has started, you know. Generations earlier, not 1, 2, 3, hundreds of generations it has started, and when we find it is effective, it is still positive, we just continue. Traditional medicine has a long history. It is a sum total of the knowledge, skill and practices based on the theories, beliefs and experiences indigenous to different cultures, whether explicable or not, used in the maintenance of health as well as in the prevention, diagnosis, improvement or treatment of physical and mental illness. Traditional medicine. I take turmeric, I got sore throat. I keep a bottle of turmeric in my room. Turmeric is a traditional medicine basically to be used for sore throat. A medicine which is continuous since last generation, hundreds of years, and it is still found useful in the modern era, that becomes traditional medicine. Here also I can just tell you, I am carrying a piece of what? Adrak, a piece of ginger. I just take it like this. I keep it in the mouth so that it gives that watering effect to my mouth and I cough less. Examples of ginger is again a sort of traditional medicine. Herbal medicine, ginger can be a herb also. Similarly, turmeric can be a herb. Herbal medicines include herbs, herbal materials, herbal preparations and finished herbal products that contain age-active ingredient parts of plants or other plants, materials or combinations. So, friends, you understood what is traditional medicines and what is herbal medicines. Here, conventional medicines manages symptom of diseases, focuses on healing at the organ level. That is a modern medicine. It focuses on the organs. If something has happened to a particular organ, it focuses on that organ. Alternative, any non-mainstream practice used to replace conventional core, and presently we have got two medical streams that can be called as alternative. One is homeopathy and second is Ayurveda. Complementary medicines, it combines conventional and alternative therapies. Functional medicines addresses functional imbalances underlying illness, promotes optimal health and function. And then comes integrative medicine, focuses on healing the individual as a whole, holistic. Use the best evidence-based therapies available. This is again CAM, complementary and alternative medicine, CAM. And CAM has got all the aspects. This is the whole medical system what we have. Traditional TCM, traditional Chinese medicines, Ayurveda, homeopathy, naturopathy. This is biology based, herbal, probiotics, vitamins. This is energy medicines, spiritual healing, Qigong, Reiki, these are all distant healing. This is manipulative and body based practice, massage, osteopathic, chiropractic, and here we involve mind and body, that is yoga, hypnosis and meditation. Again the same image being explained differently with images, with different images like mind body. You understand a person is doing yoga, meditation. Alternative medicines, we have got yin and yang. Yin is passive, yang is hard. This is again a part of Chinese traditional medicine. Biologically based approaches and manipulative, that is massage and other things. Types of complementary medicine, similarly given out differently. Each type of complementary medicine may target a specific aspect of your health. In general, complementary approaches may provide one or more of these health benefits. Relieves pain, reduces anxiety and stresses, reduces nausea, improves mood, increases relaxation, improves wound healing, encourages feelings of well-being, pleasure, positivity and inner peace, relieves muscle tension, decreases tiredness, improves flexibility and circulation. Just for smooth understanding, I divided the complete types of complementary therapy in 5 parts. In part 1, we will be generally talking about manipulation and body based practices. In part 2, we will have different types of mind body techniques. In part 3, we will have energy force, energy healing techniques. In part 4, how can we use art as a form, art form, we call it expressive art therapies, and lastly we will have naturopathy depending on the nature. Part 1, manipulation and body based practices. So, here we go. First comes massage, very important, can be done anywhere, not much of a knowledge is required, a simple knowledge and dedication. Read few more books, get some knowledge from your teacher and you can start doing massage at home. Massage relies on your body's nerve endings and pressure points to promote relaxation. Normally we can do massage anywhere, but when you talk about acupressure and acupuncture, Then certain pressure points, we call them acupoints, which are generally located on meridians. What is meridians? I will not tell you now, I do not want to confuse you. You just take this. Massage generally can be done on any parts of the body. When you go deeper and when we talk about traditional Chinese medicines, acupressure, acupuncture, then massage can be given on certain points and that can relieve you from the pain immediately. There are many forms of massage, for example, Siastu, Haller work, reflexology. However, the most widespread variation builds upon the 5 basic strokes of Swedish massage, that is flaffrarage, patricage, friction, percussions and vibrations. These are the system how you give massage. First one is slow rhythmic gliding strokes. Second is kneading, like you knead the atta, you knead the flour. If you want to make chapati or other thing, you just take the flour, put some water and start kneading it. So similarly in this patricage, you take the bunch of muscles and start kneading it. Friction, we apply pressure, steady pressure, you keep applying pressure on those parts of your muscles. Percussion, drumming, how you drum, and vibration means rapid movement. So all these are the types how you carry out massage. Massage therapy has been used to reduce stress and anxiety, improve mood and in relaxation and control pain. If you had surgery, massage can promote healing at incision sites and may prevent or reduce scarring. Foot massage has been shown to have a positive effect on pain, nausea and relaxation. This is the massage. Reflexology. This theory involves applying manual pressure to areas of your foot, hand or ear that are believed to correspond to the affected organs or body system. Reflexology may help to relieve symptoms such as pain, constipation and nausea. Now, you just see this foot. So, there are certain points like here if you apply pressure, it will affect your liver. If you got stomach ache, constipation or something, you apply pressure here. If your neck is paining, apply pressure here. So, this is the reflexology. This is small intestine, gallbladder, chest, if you got chest pain. So, this is how certain parts of your foot, they are connected with those organs of your body and you apply massage to those parts, those organs are affected and it gives positive result. Chiropractic, it is a hands-on approach that focuses on the spine and other joints of your body and their connection to your nervous system. It is basically related with the spine, back part. These approaches involve moving your muscles and joints using stretching, gentle pressure and resistance like this. Like you see the muscles surrounding the spine, they have been taken up, a gentle pressure is being given by the doctor. Cupping, this is a type of massage therapy that involves using heated cuffs to create a vacuum on your skin like this. Because of vacuum, the skin comes out, not exactly comes out, but it gets attracted and because of that nervous systems get activated. Come to mind body technique. First is meditation. Most important is a method of relaxing and quieting your mind to relieve muscle tension and achieve inner peace. This is meditation. Meditation, a very quiet place is required. A natural place, if it is available, is very good. Relaxation and deep breathing. Relaxation and breathing techniques are very useful. We will learn about Ashtanga Yoga later on. In Ashtanga Yoga, we have got pranayam. You inhale, keep the air inside, and then you exhale. When you take the air inside a deeper like this, this is deep breathing. Inhale for a longer time, keep it inside, and then slowly and slowly exhale. This basically helps to release muscle tension, relieve breathlessness, lessen anxiety, and encourage a greater sense of control. Deep breathing, lots of benefits of deep breathing exercise you have been given. This again, the students are doing deep breathing. Yoga. Yoga is again a form of gentle exercise consisting of body postures and breathing techniques. And now 21st June, every year it being observed as International Yoga Day, thanks to our beloved Prime Minister Narendra Modi, that he upheld United Nations organization in 2015, and they announced that every year 21st June will be observed as International Yoga Day. Very good Ashtanga Yoga are there. There are 8 limbs of yoga. You will learn later. Animal assisted therapy. Sometimes if human beings can't help you, go back to your pets. A therapist will team up with dogs or other animals to help you better cope with your health issues. Like here the child, he cannot study alone, he just wants a company. So, okay, fine. His parents bought a puppy, doggy, just he will remain with you. So, this is animal assisted. Biofeedback. It is a training technique through which you learn to control your thoughts, emotions and behavior. Your therapist will measure your body's functions, for example, EEG to measure brain waves, ECG to measure heart rate, EMG to measure muscle contractions. So, this is again scientific, basically biofeedback, visualization, guided imagery. You just visualize, you may close your eyes, you may keep them open, but you keep on visualization in a very short, in a simple way. If I want to explain, it is sort of dreaming, but dreaming can be anything. Visualization, you are doing it for a positive purpose. For example, when in a state of relaxation, you might focus on feeling stronger or better, or you might picture the destruction of tumor cells. If something is happening, like now presently I am having cough, if I just visualize, close my eyes, okay, my cough is gone, I can speak nicely, my voice is stronger, I will not cough again, at least not whenever I am lecturing around. I visualize myself getting stronger and stronger, healthier and healthier. It can be done by yourself also, it can be done by some teacher also. Here the teacher or the instructor or maybe the mother asking the child to visualize. Hypnotherapy is similar to guided imagery, but a physician or licensed hypnotherapist induces deep relaxation. Here the lady is just sleeping on the sofa and the hypnotherapist is guiding her. It is very helpful for so many things: alcohol problems, anxiety, weight loss, eating disorders, motivation, stammering, stops smoking. Many things are there where a hypnotherapy can be useful. Prayer, very important. Prayer therapeutically for mental and emotional healing, and you don't require anybody, it can be done anywhere. Whether God is present there or not, whether there is a temple or a mosque or a church or anything, you can do the prayer wherever you want to, and when you pray from your heart, the God has to come in front of you. Prayer can be used as a tool for exploring your heart's or soul's past. What is there in your heart that can come out during prayer. This can help you to better understand yourself and to explore and release feelings. Your prayer is personal. The therapist merely acts as a facilitator, because the prayer actually it has to come from your heart, not from the therapist or from some instructor. He will just tell you do prayer like this. Prayer, whenever you want to pray God, pray any Almighty, wherever, whomever you want, you have belief on it, pray from your heart, and I am sure the prayer will be answered. May not be immediately, but it will be answered. Prayer therapy. Coming to third part, energy force therapy, where energy is required. Tai Chi. Tai Chi is a sort of meditation, focusing, and motion is there. So, Tai Chi we call it meditation in motion. Tai Chi means life energy. Qi in traditional Chinese medicines, Qi, they write it as Qi, but we pronounce it Qi, Tai Chi, like Qi Gong, Tai Chi. Qi is life energy, and in India we call pran or life energy or something. So, it calms the mind and promotes self-healing. It is practiced more as a form of preventive health care than as a response to an ailment. You just see, motion is there in Tai Chi. Therefore, I just said, meditation in motion, moving forward, hands forward, legs in a walking position. However, head is straight, eyes are focused. Therefore, it is meditation. Generally, it is being done in a group, can't be done singly. Qigong, it's again a life. Qi means life energy. Gong means mastery. You have mastered the art of balancing your life energy. That is called Qigong. It's again TCM, traditional Chinese medicine, basically breathing techniques and meditation. Like this is little more offensive sort of, you call it defensive postures. Therapeutic touch, a practitioner attunes their energy field with yours so that disturbance in the energy flow are balanced and your body's healing power can work freely. This is therapeutic touch. Reiki, it's a form of Japanese spiritual healing that has its roots in ancient Tibetan Buddhism. Reiki claims to balance the body's energy centers of chakras and dissolve energy blockages that lead to disharmony and disease. Chakra, there are 7 chakras in the body starting from top Sahasrara and it goes to Muladhara. Then another term you will understand, you will come up later on, is the meridian. Now, joining all the chakra, there are certain lines, imaginary lines, going up or down vertically, and on these all those acupoints are located where you carry out acupressure, acupuncture and all other things. This will come later, just for your understanding only initially. This Reiki is being provided. Acupuncture, by sticking very fine solid needles into points of your body, very fine solid needles. Acupuncture is believed to encourage the release of endorphin, natural painkillers, which can also increase feelings of well-being. You can just see, they are very fine needles. When they are being inserted, you do not feel anything. The point where the needle has been inserted, that is called acupoint. Now, these acupoints, they are same for acupressure as well as for acupuncture. Acupressure, massaging, pressing or touching certain acupressure points on the body may help relieve stress, tension, deep troubles and more. This is acupressure. That is acupressure. The pressure can be applied generally by fingers. If more pressure is required, you apply with your thumb, or some tools also can be used for acupressure. Magnets can be used to reduce pain or enhance healing, like here 2 magnets have been placed on the back side of that patient. Coming to 4, expressive art therapy. How art generally art is what? Art comes from your mind. A mind is expressing something, and you can express through what? Speech, writing, laughter, color, art, anything. These are the modes you generally take to express your emotions. So, it is called expressive art therapy. Journal write, you write down your ideas, writing as therapy. What do you write? You write what you are thinking about. If you are hurt by somebody, your friend Raja abused you and you are really hurt, you just go down on your table and just write down, Raja hurt me today, he abused me, I didn't like it, So, when I write it 2 times, 3 times, that idea goes off. Okay, fine, I let go Raja. So, writing, when you write down what is happening in your mind becomes calm, quiet. By writing, you can accept your mistake also. The book written by Mahatma Gandhi, My Experiments with Truth, there he writes, as a child he had done something wrong, he had stolen some money, he didn't like it, he did not have any courage to express to his father, Father, I did this. So, what he did? He wrote down in a sheet of paper, I'm sorry father, I have stolen some money, I don't like it, I'm very, very sorry and I will not do it. He went there, his father was sleeping, his father was sick, he gave the sheet to him. When his father read that, tears came down from his eyes, and those tears made Mahatma Gandhi what? A man of truth. Speak truth, act truth, believe in truth. So, this is the effect of journal writing. By writing a small sheet and taking the responsibility that I had done a wrong thing, your heart gets cleansed. Art therapy, drawing, painting, sculpting, anything which is generally done by art, like all these people, they made a collective art. Music therapy, you don't have to be a musician, even you don't have to be a singer also, you can just enjoy the music, and if you have got certain songs, when you hear those songs you feel very happy. It's an expressive art form designed to help individuals achieve harmony and balance. What is required is a harmony. Harmony with the nature, harmony with the people, harmony with the job what you are doing, and balance in your behavior. So, this comes when you hear a particular good piece of music what you love. Music therapy includes both listening to or playing also. If you can play some organ, musical organ, very good. Like this is what people are enjoying, whatever they can do. This is a group basically helping sick children. Landscape theory. Why do we want to, like whenever I come to IIT Kanpur and I see the landscaping, almost all the buildings have a beautiful garden, nice landscaping. So, it gives you that sense of relaxation. Today morning again I went for a walk, roads were very clean, lined with beautiful long trees. A silent, gentle, cold breeze. So, that is what relaxes you, landscape with the nature, showing of peaceful, relaxing landscapes that can evoke calmness and tranquility. Like here, the father and son duo, they are doing their own landscaping in their home. Support groups, very important, and this is what we generally do. Whenever our friends or relatives, they require some support, some bereavement or something has taken place, we go there, sit with them, and you support each other. Last part, we talk about naturopathy. There are so many things what we are going to study, my dear friends. Naturopathy, hydrotherapy, water therapy. You don't have to go to any doctor at all. Learn what is water therapy, and most of the problems, particularly with constipation, will go away with water therapy. Diet therapy, most of the problems are with, because most of the time what we do, we eat because our tongue wants. Our stomach doesn't want. Our stomach is full, but whenever you see something very tasty, nice, a nice flavor is coming, you go to some sweet shop and see the things on that, what do we call it, just behind the glasses, they are being showcased, and you feel like eating something, you buy and eat. You are not actually hungry, your stomach is full, but still you want to eat because your mind wants to eat. This is the main principle. Eat when it is required, when your stomach asks, when your stomach is hungry, stomach is empty, eat. And eat again natural food. That is the part of naturopathy. Diet therapy. I have put a measure tape here so that I have also gone little fat, sorry. But at times I also measure what is my waistline. It's not, it has increased now. Diet therapy, aromatherapy. The scents released by the oil are thought to act on your hypothalamus. In theory, a smell might affect your mood, metabolism, stress level, and sexual desire. I give you a simple example. You have got some time at your hand. About 10-15 minutes. Where will you go? A beautiful garden is located nearby, or a garbage dump? Where will you go? Definitely you like to go to a garden. Why? Aroma is there, beautiful landscape is there, natural flowers, different types of flower, different types of plant, Aroma, that flavor, that smell, and that helps you to refresh your mind. In a deeper sense, it's a part of your reflex action. It reduces the stress level, it increases the sexual desire. We'll learn about aromatherapy in detail. We are given almost about 2 hours to aromatherapy. Gentlemen, this is the course finally where we are going to learn almost more than 20 modalities of complementary medicine. 20 modalities. Aim here is not to make you a doctor or anything. Aim here is you must know what is all around, what are the complementary therapies, and little knowledge, some interest from your mind, you can understand it and you can make your life very easy. Particularly naturopathy or something, you will be surprised. As a child, I had been a naturopath. As a child, I knew what is to be eaten, what is not to be eaten, when to go out, when to exercise, what to wear. It's a part of naturopathy. There are so many things, my dear friends. More than 20 modalities. So, please stick to this. This is the first week, and you have to go a long way, 11 weeks. So, be with us for 3 months, and I am sure you will learn quite a few things about integrative palliative care. Thank you, friends. Thank you.